The pandemic has impacted every one of us, and as clinicians, the ways of practicing in our respective fields was not left unscathed and presented a need for adaptability. I'm Mona, and along with Makeda and Alan, we were witnessing the new pressures our colleagues were facing. Coupled with our interest in workflow and impact on professionals' working practices, we wanted to find out what changes were being made to the management of emergency departments, or EDs, during the first year of COVID-19, and to what success. As these changes initially happened rapidly with limited preparation, we wanted to amalgamate this knowledge of change and their relative successes. We therefore set out to conduct a rapid review, searching 6 main databases and 2 grey literature sources under the intersection of 3 main categories for publications between January and December 2020. Following initial screening, 94 studies were retained, and after second screening and discussions between all 3 of us, 74 studies progressed to scoring and thematic synthesis. Figure 2 demonstrates our approach. 9 key themes were evident from our efforts in the second screening, and each study was then scored on its degree of relevance to these themes. The 9 key themes are presented in Figure 1, including the number of studies that mentioned the topic and the degree of detail to which it has been evidenced. It's critical to note that these themes are not mutually exclusive, and so EDs implemented a combination of these measures with varying degrees of success. Important to highlight also that only 4% of the studies originated from the UK, 15% from other European countries, and 52% from the USA. The majority of studies presented changes to the triaging system. However, key to note that adapting triaging and screening, an initial step in the duties of an ED, was often a cornerstone of a broader change program implemented. Many studies adapted triage in order to serve an expanded ED, for example, capacity created by a standalone external screening area with the added benefit of outdoor ventilation. Other studies adapted triage in order to better facilitate departments' infection control or to include newly initiated patient pathways. Adapting the triage system was also accompanied in some studies by the introduction of telephone or video screening in advance of entry or admission into the ED. This demonstrated how multifaceted COVID change programs have been in EDs and the centricity of triage. Our rapid review provides insight into the ED management practices implemented throughout the early stages of the pandemic. The aim has been to better inform targeted, timely innovation and establish successful implementation models in response to the ongoing pandemic, as well as to provide insight for policy and practice development for large-scale public health emergencies. The studies have demonstrated that adaptable and efficient triaging mechanisms and staff well-being, training, and feedback are the key considerations reported so far in successfully implementing rapid change. Given the limited UK representation, we plan to investigate these key findings through case studies of practice changes within 3 UK-based EDs.